Have you ever wondered about the treatments that paved the way for modern mental health care? Today, we're diving into a story that's as electrifying as it is revolutionary. We're going back to 1938, a time when understanding the human mind was still a vast, uncharted territory. The world was on the brink of massive change, and so was the field of psychiatry. In the hospitals of that era, doctors were desperately searching for effective ways to help patients with severe mental illnesses, conditions that often left people isolated and without hope. The available treatments were limited and often ineffective. But in Rome, a pair of doctors, Cerletti and Lucio Bini, were about to conduct an experiment that would send shockwaves through the medical community and change the course of psychiatric history forever. Before we get to that fateful day in 1938, let's set the stage. The idea of using shocks to treat illness wasn't entirely new. For decades, doctors had been experimenting with convulsive therapies. The theory, developed by a Hungarian neuropsychiatrist named Ladislas Meduna, is based on a curious observation. Patients with epilepsy, who also had schizophrenia, seemed to experience a reduction in their psychotic symptoms after a seizure. This led to the antagonism theory, the idea that epilepsy and schizophrenia were somehow mutually exclusive. If you could induce a seizure, Meduna theorized, you might be able to treat the psychosis. His initial method was chemical, using drugs like metrazole to trigger convulsions. The results were mixed, and the process was often terrifying and physically dangerous for patients with a high risk of bone fractures. It was clear that a more controlled and reliable method was needed. This is where Cerletti enters the picture. He was an Italian neurologist and psychiatrist, already well respected for his work. Cerletti had been studying epilepsy for years and was looking for a better way to induce seizures in a research setting. His journey took an unexpected turn at a Roman slaughterhouse. He observed that pigs were being stunned with an electric shock applied to their heads before they were processed. The shock rendered them unconscious but didn't kill them. This was his aha moment. If an electric current could safely induce a seizure-like state in a large animal, could the same principle be applied to humans as a form of convulsive therapy? The idea was radical, and the ethical considerations were immense. But driven by the desperate need for a better treatment, Cerletti and his colleague Lucio Bini decided to pursue it. They began by experimenting on animals to determine the right voltage and application method to induce a seizure without causing harm. Bini, a skilled engineer, as well as a psychiatrist, was instrumental in designing the first electroconvulsive therapy device. It was a crude machine by today's standards, but it was meticulously calibrated. They needed to find the precise electrical dose enough to trigger a therapeutic convulsion in the brain, but not so much that it would cause permanent damage or be fatal. After extensive animal trials, they felt they had honed their technique enough to attempt it on a human patient. The stage was set for a medical first that would be both celebrated and condemned for decades to come. The first human patient was a 39-year-old man who had been found wandering the streets of Rome speaking an incomprehensible jargon. He was diagnosed with schizophrenia and had been unresponsive to any other treatments. In April of 1938, at the Clinic for Nervous and Mental Diseases of the University of Rome, Cerletti and Bini prepared to conduct their groundbreaking procedure. The atmosphere in the room must have been incredibly tense. They were venturing into the unknown, applying a powerful force directly to a human brain. With the patient's consent obtained from his guardians, they placed electrodes on his temples. For the first attempt, they used a low voltage, about 80 volts, for a fraction of a second. The patient's muscles tensed up, and he mumbled, but no seizure occurred. Some accounts say he even pleaded, "Not another one, it's deadly." Imagine the pressure Cerletti and Bini felt in that moment. Their patient was conscious and clearly distressed. Their colleagues urged them to stop. The risk of failure was enormous, not just for the patient's life, but for their own careers. But Cerletti, convinced by his research and the potential benefit, decided to proceed. They increased the voltage to 110 volts and applied the current for half a second. This time it worked. The patient lost consciousness and experienced a grand mal seizure, lasting just under a minute. As he slowly regained consciousness, the team watched with bated breath. The immediate results were astonishing. The patient sat up, and when asked what had happened, he spoke clearly for the first time in weeks. He simply said he wasn't sure. The change was immediate and dramatic. Following that first session, the patient received a series of treatments over the next few months. His condition improved remarkably. He went from being incoherent and catatonic to being able to communicate reason and eventually return home to his family and to work. The news of this success spread like wildfire through the psychiatric world. Cerletti and Bini had discovered a treatment that was faster, more reliable, and in many ways safer than the chemical convulsive therapies that preceded it. They called it electroshock therapy, EST. It was quickly adopted by hospitals around the globe as a frontline treatment for severe depression, mania, catatonia, and schizophrenia. For the first time, doctors had a tool that could bring patients back from the depths of mental illness when nothing else could. It was hailed as a miracle cure. However, the story of electroconvulsive therapy, now known as ECT, is not a simple tale of triumph. In the early days, the procedure was administered without muscle relaxants or anesthesia. The seizures were violent, often resulting in broken bones, dental damage, and severe memory loss. The public perception of ECT, fueled by dramatic and often inaccurate portrayals in movies like One Flew Over the Cuckoo's Nest, became one of a brutal, punitive tool used to control unruly patients. It was seen as a barbaric practice, a symbol of a coercive and inhumane psychiatric system. This image problem, combined with the real and significant side effects of the unmodified procedure, led to a massive decline in its use by the 1960s and 70s, especially as new psychiatric medications became available. But that wasn't the end of the story. While the public's view soured, researchers and clinicians continued to refine the technique. The modern practice of ECT is vastly different from that first experiment in 1938. Today, it is always administered under general anesthesia, and patients are given a muscle relaxant to prevent the physical convulsions. The seizure is confined to the brain, where it is monitored by an IHG. The electrical stimulus is precisely calculated and often applied to only one side of the brain to minimize side effects, particularly memory loss. The procedure is brief, and patients wake up minutes later with little to no memory of the treatment itself. Despite its controversial past, modern ECT is recognized as one of the most effective and fastest-acting treatments available. For certain severe mental health conditions, it's most often used for treatment-resistant major depression, a debilitating condition where other therapies and medications have failed. Now, for patients who are actively suicidal or suffering from catatonia, ECT can be, and often is, a life-saving intervention. It can produce dramatic improvements in a matter of days or weeks, while medications can take much longer to work, if they work at all. We now understand more about how it works, though the exact mechanisms are still being studied. It seems to reboot the brain, changing brain chemistry and connectivity in ways that relieve symptoms. So, when we look back at that day in April 1938, we see a pivotal moment. The work of Cerletti and Bini was a double-edged sword. It introduced a powerful and life-saving treatment, but its initial crude form also led to significant harm and a legacy of fear and mistrust that persists to this day. It's a stark reminder of how far medicine has come, and a lesson in the complex ethics of medical innovation. The story of the first electric shock therapy isn't just about a medical procedure. It's about the desperate search for hope, the willingness to take monumental risks, and the long, complicated journey toward a more humane and effective way of caring for the mind. It's a crucial chapter in our ongoing quest to understand and heal the most complex organ in the known universe, the human brain. Thanks for watching, and if you found this piece of medical history fascinating, be sure to like, subscribe, and hit the notification bell for more deep dives into the stories that shaped our world. See you next time.